And thank you very much. I was about to say, please record. Um, and for today's discussion, we're going to talk about what next. We've had a rough year. Everybody in the call can actually relate to that. But welcome to this discussion. As I mentioned, we're trying to talk about what next, despite the hurdles that we've been facing. Now, key facts. We know there's a lot of progress that has been made. Numbers don't lie, and I'm just projecting some snippet of the reports from the Global Fund. 17 million lives, that's a lot of lives that has been saved. And the progress that we've made around TB coverage from 2002 to 2023, I mean, 3.1 million to 7.2 million, we cannot afford for those numbers to go backwards. So that's why we're having today's discussion. And just to give you a brief of who you're going to be seeing speaking today, we're going to start off with the opening session. We have it divided into three. We'll have the opening session. Sorry, ladies and gentlemen. NIL, could you double check the people who are raising their hands? So ladies and gentlemen, we will have a Q&A session later on. So everyone maybe try and use the chat and we'll pick it up from there. Now, as I mentioned, my name is Ms. Viziotai. I'm the host for today, but we do have amazing opening session where we're going to hear from Stop TB Partnership, Global Fund, and also a community voice. These are the key players right now around fighting the diseases. You know these faces, they're not new, but what they're going to say today is going to help us know between now until 2030, what next? What can we do and what can we support in as communities and civil society organizations? Then we're going to move into the first session where the excitement here is about money. That's all we're thinking about. This is the dent that we're facing right now. And it's going to be moderated by Dr. Lydia, and the panel is going to talk about sustainable financing, domestic resource mobilization, blended finance, you name it, anything money related is going to be discussed by this particular panel. Then this is where it gets very creative. We're talking about innovation. There's a lot of things we've done within the TB space. What can we sustain? What didn't work? And what can we push as civil societies and communities to ensure that if there's any sort of funding coming in, it's directed towards that particular innovation that has been working. It's going to be moderated, of course, ladies and gentlemen. You've already met Armand Shukla, a very vibrant young person, especially within the TB space. And of course, we have other panelists who these faces, as I mentioned, very familiar faces. These are people who have actually been on the front line of the fight against TB. And as I mentioned, we're on a strict countdown. 2030 is just around the corner. And what will happen then? We have an amazing guest speaker, Dr. Steven, who's going to also let us know in terms of TB reach, where are we? What needs to happen? But then we will allow you as communities, as civil society, as TB advocates to talk about the next step. So we'll have a Q&A session where Rachel will take us through and we get a closing on what have we discussed in an hour and a half. So ladies and gentlemen, I didn't want you to, get bored or think this is going to be a PowerPoint sort of a presentation. No, that was the only PowerPoint presentation. Now, ladies and gentlemen, I'm going to ask the keynote speakers to be on camera. And I'm very excited about this particular part because we have TB, Stop TB, we have Global Fund, but we also have the community's perspective. So Dr. Enos, I know you're on the call. Please, if you could have your camera on, that would be awesome.
My camera is on. I'm surprised. Are you
see
seeing me? Okay.
I can see you now. Yes, I need to pin you.
I can see a thumbs up
Dr.
from my hero,
there.
Dr. Lichika, is giving a thumbs up. So it means I'm
definitely.
on.
Let me pin you all and bring you all on camera. Peter, if you can also have your video on, I'll just pin the three of you on camera. We're talking about TB. We've made so much progress, but we need to talk about what next because it's challenging time. And I'm going to ask Dr. D2 to start us off because, Stop TB, we're always looking at Stop TB when you're talking about eradicating TB, right? It's 2030, it's just a couple of years, not a lot of time. Let's hear what next from Stop TB. Dr. D2, over to you.
Yeah, so thank you so much. It's really great to be here. It's really great to be part of this meeting, and it's really great to see you all. I feel like at home because I know everyone, and I know my dear colleague and amazing fighter Massini. Great to see you. Um, on this happy note, actually, it's not a necessary happy note, but okay, it's a very timely conversation, and I congratulate Yanaso as always for you know, pushing for this kind of discussions and the webinar. And I want to thank also to the colleagues that are all in line. And I'm happy that our TB champions are coming in, and it's amazing to see the countries that are participating in this. We are navigating waters that we don't know about the waters, okay? We have some clear things, the pillars that we try to step on, but then there is a lot of troubled water around us. What we have as clear pillars, and I will say for the TB response, is that there is an unprecedented ambition, there is an unprecedented push at country level, and embracing the TB response like we never had before. We see countries really keen to fight with TB. We see as well another strong pillar that we can build on. We see as well the innovations that are coming in the TB space that we didn't see that much before. We have an incredible number of tools. We have an incredible number of, you see, perspective of new treatment regimens, perspective of new drugs, perspective of new combinations, a lot of diagnostic tools going from you know, becoming miniaturized and easy to carry to tools that are becoming, given the perspective of a very cheap diagnostic. We are also looking at the perspective of having a vaccine, and you know, in the future. So that's another pillar that we can solidly hold on, is the innovations. The other one that I'm very proud of is also the fact that we have an incredible communities and civil society and networks of TB survivors like never before. People that are, I think, very able to discuss about TB, to speak about TB, people that have experience on how to address TB at the country level, and also a lot of knowledge on how to work with communities, how to work with the civils, how to work with the populations that have difficulties in accessing the services, how to support people to get diagnosed, to continue their treatment, to not go through stigma, and so on. And the other, I would say, pillar that we have is that there are a lot of discussions happening now about, the countries that I said in the beginning is not just the ambition. We also see an increase in the number of people diagnosed and treated like we never saw before. And then the last one that I want to say, there is a much more logical conversation happening now about integrating the TB services and the work within the country health system in a more comprehensive way. And it's not just for TB, it is for the rest of the diseases as well. You know, it's like looking at a person, not just from the lenses of TB or HIV or malaria, but looking through the lenses of, you know, you go to a primary healthcare or you go to a health post, you need to tell all your issues, you know, you need to express all your issues. So we need to ensure that we are able to provide the services closer to people and in an integrated manner. The time in which you buy an equipment is that, you know, and you are doing just one of the diseases have passed. So these are some very strong pillars on which we can construct. And also, I want to say that, but the water we navigate is troubled by several things. That if we are smart, we are able to use this in our benefit, but we really need to be smart, and it will not be very easy. Because forward looking, it's very easy to get some worried or sometimes discouraged, right? As you rightly said, actually we have 5 more years till 2030, okay? we need to, it's all year of 26, 27, 28, 29, and 30, because it's by the end of 2030. That's how, all these data are coming up. So we have a good amount of time to be able to do some incredible things. Because if you sit, all of you, and remember where we were in October 2020, do you remember? It was COVID. We were all in the house, pretty desperate, worried that we didn't see the end of. You remember? I remember in September and October 2020, I was really worried of what the future will look and are we getting out. So, and see how much happened between October 2020 and now, in 5 years. So we need to think about this in looking for the future. But it is true that we are coming in, as I said, in some troubled times and so on. But the troubled times came from changes in the direction of funding by some donors. I want to tell you something which I actually didn't know. I have to confess, you all know Sahu, so Sahu is preparing some papers for the board, and the money that were available for TB response from US remained the same. They didn't cut. What happened, not for Stop TB, in general, what happened though, it happened a reprioritization. It happened a change in the scope of work, and there was a several months disruption at national level, as you know. So there were countries that were less dependent on the external funding, not just US, that were able to readjust pretty quickly, and there were countries that were impacted and were unable to readjust. Now, the biggest challenge that we have, because here we are communities and civil societies, is about the funding for community and civil society. And that's where the concern stands. And that's because the donors, not just US, but others, even though I speak even a lot about the others, are claiming about or explaining about the fact that civil society, communities, vulnerable groups are close to their heart. We don't see that coming up that much. You see, we didn't see any donor coming and saying, knowing the gap that were left, and for us in Challenge Facility was really dramatic by US. Nobody came to say we can step in, we can support, even if they would have do it for one country, right? They didn't need to do for everyone, but say, I will take over Kenya and Rwanda or whatever, and South Africa and so on. I will help the groups that are there formed. So the concerns are, so going forward, including with the Global Fund and so on, there are three things that I think are very important. And I'm not speaking here about replenishments or making sure the money are coming and so on. That's very important, but I'm speaking about three things. One is we need to make sure that there is a clear understanding of the value that communities and civil societies are bringing in the TB response. And this needs to be articulated. It needs to be very specific as well. I think we cannot add and say, oh, we are there to do advocacy. No, we are there to do, on one hand, service delivery. We are able to accompany people to get diagnosed, to follow their treatment, to reduce their shame and stigma. We are there to educate other people in the community to understand their diagnosis, to understand the diagnostic tool, to understand the vaccine is a huge thing, for example, because there is so much hesitancy. We are there to demand that the country take care of their own people. We are there to remind our leaders that they need to take care of the people. We are there to ensure that there is domestic resources to support us, but also to support our people. We are there to remember the presidents and the prime ministers that the treatment of the citizens of our country should be the responsibility of the country. So it needs to be framed in very concrete deliverables. So that needs to come, and this is something Aman knows, and I think Stephen knows, and so on. We will discuss even at our board, that it needs to come very clear across, because we are used to say we are doing advocacy and we are doing demand creation, which is true. These are exactly that. But it needs to be very concrete and framed in, look, what is going to happen if we are not there? Because the penetration of the public sector into the communities is very limited without civil society communities and TB survivors. They will never be able to deliver the same type of services. And it needs to be framed in this way. So that's the first. The second is to ensure that whatever is constructed at national level remains sustainable. So, you know, we, as you probably, there is a lot of funding going from Global Fund. There was a lot of funding from PEPFAR, right, going to organizations. The fact that once this tap was closed, created such a big disruption, scared the shit out of me, I imagine of you as well, because it was very clear that without those money coming from somewhere outside, we are not able to function. And in a way, it's true for Stop TB as well, right? We should not be dependent as Stop TB of only one donor and in so big. So whatever is like, okay, funding is coming from a donor, a part of it should be used to ensure that it creates sustainability, to ensure that either you get a legal status, either you register, either you use that to be part of some official structures, or the best one is to ensure that the government has a budget line for civil society and communities in their program and so on. But I think it's time to think about, yesterday I was part of a discussion, a pretty high level. I was impressed. They invited me because they say I say things very direct. It's not about development anymore. It's sustainable development. So we should not allow to take money unless a component of it help everybody and you to continue afterwards. The third thing that I want to say is around the Global Fund and the fact that, you know, with the GC8, we need to ensure that there is no wipeout of the communities and civil society. Our concern from TB is that the way that the Global Fund invested in the TB communities was probably not what we wanted to see, and that's why we feel that what Challenge Facility is doing by going really to the grassroots and providing this and directly, and what we obtained over years, we feel that's a very good mechanism of funding communities from the TB side through the Challenge Facility. But beyond that, it's also very important that you see, and this will be difficult, is that at the country level, and it's part of what I said before, the discussions with the CCMs and the inclusion of civil societies and communities and TB crowd in the CCM's discussions will be essential, even more than before. And I tell you why, for two reasons. Global Fund as well, we don't know. That's what I'm saying, navigating these unknown waters. Global Fund itself doesn't know how big the replenishment will be. And if the rubber hits the road and the countries get smaller envelopes, we all know who is cut first. You already see that. It's already happening. That's why it's not enough to be at the CCM discussion. It's very important to say why, and to say without this, this is not going to happen. Without this, this is not going to be that solid. So that will be extremely important. And I am very worried for TB because usually we are not at the table, or we are not enough at the table. You know, the TB community maybe is one person, not much listen. So we need to get mobilized to ensure that the TB community representatives, survivors, whatever you put it, civil society, are part of that discussion. And the other one is much more important than this. It's the voice within the country systems. You see, even US money, as I said, will continue, but they will go bilateral. Okay. I know as a fact, because we are dying working here, because at our board, the new leadership of the US government for health is coming to our board. And we know that they will come and go bilateral agreements with countries. And we know that, for example, in November, very likely, I hear, there will be 10 countries from Africa visited to discuss these bilaterals. In these bilaterals, it will be government and US. And my worry is that there will be governments that I completely trust And I think they will bring civil society on board, or at least will speak about civil society. But there are other governments that might not even mention the need for civil society. And here will be extremely important because you all have some links with the governments to try and position yourselves, yourselves, because I mean, it's not about us, but at national level, as the partners or the important, not partners, the essential ones to be at the table. Maybe not when the discussion is happening, because I imagine will be the Ministry of Foreign Affairs, Minister of Health. I don't know how. I'm just speaking out loud, but I know as a fact that by March 2026, US will sign 71 agreements with countries, with 71 countries. They will sign bilaterals. In the bilaterals that they will sign, I don't think they will go towards the implementation. It will be high level. But without positioning the role and the importance of communities and civil society in those countries on the TB response, that will be difficult to come in afterwards. And that is specifically for US money. Okay, so I'm not speaking here about other donors and so on, but I'm telling you that is the US piece. For the Global Fund was about the CCM. But I think that all along, and I will stop here because you will never invite me to speak again. I promised 5 minutes and I'm at 20. I really am sorry, but I got because I am so outraged that all the great work and great will and amazing things that you are doing can be lost. And it's not just a donor's problem, or it's actually not necessarily a donor problem. The countries need to see this value. And we will be here to help you and support you. We will work together. We need to think in which way to make the case with the governments and show the added value of the community, civil society in delivering services in this and that, whatever I said. So I will stop here with all the love and respect for all of you, because I am so happy you keep going. And I'm a big fan of all of you here. I have a screen of amazing friends and faces here. So thank you so much. And thank you, Lizzie, for
Thank you, Doc. Thank you very much. Really appreciate that. And what I like is I've seen Dr. Enos take a lot of notes, and that means there's good things coming from his end. But before that, Doc, please, I'm just going to let Peter chime in, because I know we are convening because the Global Funds 2025 report is out, and we need to dig deeper into that. But Peter, over to you. We've spoken about the role of survivors, the role of communities, and clearly we still need to push that particular angle. What are your sense around what's next, especially from a survivor and from a TB champion perspective? So Peter Mushui, over to you. Do not worry. I like when people have technical challenges. Then that means that something is working.
Hi,
Over to you,
everyone.
Peter. There you are. Hi.
Yes. Hello.
We can hear you. Can you hear us, Peter?
First of all, I would like to thank everyone for joining this meeting, especially our leader, Lucia, Steve, and Lizzie. Now, sorry. There's a call coming here. First of all, I would like to thank Lucia for every I'm sorry. I would like to tackle some few remarks on TB in Kenya. For example, on financing the community. I can say that there is a lot that we are doing in our community, especially we community champions, TB champions, led by our leader Steve Nguva. I think we can achieve a lot if we can get support. If we can get support to do some activities in our community, to educate our community, I think that's the main thing that I would like to comment. That if we get a good support as a TB champions in Kenya, I believe and I'm very sure by 2030 we can end TB. For example, we have so many activities in Kenya. We have some musicians. We have so many activities in Kenya that we can use to fight this TB. And for me, what I can say is it's all about support. If we can get support as a TB champions in Kenya, because we are many, and I can tell that we can do something. If we can get support as a TB champions in Kenya, we can fight this TB. Thank you.
Definitely, Peter. Thank you. And that is just from Kenya, Dr. Enos. This is just one particular country. And we've known that lived experiences really work when it comes from somebody who's been through the whole, been affected by TB. So that whole process coming out from somebody that you can relate to really works. Well, over to you, Dr. Enos, because we are talking about the Global Fund's results report. We're talking about TB today. Let's see. I mean, I've seen you write notes, so I'm pretty sure there are a lot of points you'd want to share.
No, thanks a lot, Liz, and thanks for convening us. And yes, I take notes, especially when Luchika speaks. She mentored me when I had only Kenyan experience. She put me on the global stage, and I'm a product of her mentorship. So if I don't measure up in these remarks, blame it on her. But I really have a lot of respect for her. And good to hear also Peter speak. He says from Meru. Meru is a place that actually I started my journey as a healthcare worker. I was also involved in establishing the first gene expert there and all that years ago when I was a provincial TB coordinator. But also important, I think, just to see colleagues, as Luchika says, on this call, who are really a dedicated group and who are at the heart of the response. And I can tell you, Lizzie, that I've worked with colleagues like Mukuta in Dar es Salaam and in parts of Kilimanjaro. I've worked with colleagues in Nigeria, like Ugu, like Stephen John, who is here, and many others. Both in many places like Lagos, and I've been also just seeing the work that they are doing. I've also worked with Stephen in Kangemi, in Nairobi. Really, the first line of what goes on. And when I was a national TB program manager of Kenya, the people who gave me the most support were the civil society and people affected by the disease. The colleagues like Maureen Mrenga, Evelyn Kibushi, really supported my career in Kenya. So I have utmost respect for this group, and I've seen firsthand the work they do. That's why I support the comments by Luchika that they are important, because innovations by themselves cannot reach into the hands of those who need them. There has to be a catalyst for who take them right to the hands. And I like the way she framed about articulating what communities can do. And an important, as we move, she talked about innovations. An important area that civil society, affected communities can do is to ensure that these new innovations actually reach the people that need them the most. Otherwise, they just remain tools that are there. And that's an important, and for Global Fund, I'll not give you the detailed results. I'll share a PowerPoint presentation, which we can share with members. It's hard to give numbers in a dialogue, but just to acknowledge that the 2025 Global Fund results report give us a reason to be proud. But also, as Luchika said, there's also a reason to be concerned. One, to be proud is that we are saving in 2024, we saved more lives than ever before. Yet the progress is getting into an element, she used the word sustainability. It's becoming extremely important, sustainability. There are declining resources, and all these, one, provide a risk for a slowdown. But let's just look at the progress. Like in 2024, we all know, and I think you shared that slide, 7.4 million people received TB treatment. Highest number ever, courtesy of the colleagues here, because there's somebody who actually did go find the people, did link them on treatment, and ensure that they complete treatment. helped to ensure that innovations like digital chest X-ray and even new upcoming innovations, I know my brother Stephen John is doing some work on near point of care, is actually finding what is the best way to get it into the hands of those who care. But then TB treatment coverage has also risen. From 2015, I was the National TB Program Manager of Kenya. The global TB treatment coverage was 61%. In 2024, it was 75%. This is enormous work, courtesy of this colleague. And Global Fund, of course, credits that it has contributed to saving 70 million lives across HIV disease, but it says that as a partnership. So the word is that as a partnership, is a partnership with all these colleagues that we have reached this result. And colleagues here from Africa, it's important to contextualize that the contribution of Africa, of course, in terms of absolute numbers, the huge numbers, and as Luchika will tell you, would be in Asia and all the absolute numbers. I'm not downplaying but Africa contributes about 25% of the burden. But in some countries, the actual per capita burden we know is extremely high. And this is linked to the population. And then, therefore, these gains, even in Africa, reflect the power of the activists that I've mentioned here, the peer educators, the civil society, and the champions who do what we call last mile connection. Ensure patients are not lost. And then, an important area that are coming, and when I was in Stop TB, an important area that was started was holding systems accountable. And there are many ways that you are experts in doing that. That's an important area. But there are challenges. And Luchika highlighted that even as we celebrate, we must be candid, that these gains can be fragile. That she mentioned about the funding gap that is there globally. And that the CSOs struggle with unpredictable funding, while probably essential community-led services such as patient follow-up, literacy, community monitoring remain largely under-resourced. That's true. That's true. A Global Fund contributes to it. I know work done by Stop TB contributes to it and other partners, but it remains under-resourced and it could be more resourced. So that's important. So but there are opportunities. I think now it's being solution-oriented. One is the area of innovation. Innovation provides opportunity. And in the last 5 years, colleagues here have worked to ensure digital chest X-ray, short arrangements like for drug-resistant TB, BPAL, the 3HP, reach the people that they can. But now we are also moving to get additional arsenal that can be available, like near point of care diagnosis that will be available. And moving away probably from sputum and integrating other tests that are not sputum-based, enable us to reach more children, enable us to reach people living with HIV who don't produce. But as we've said, this is where I think we also need to define our role as the civil society and the community actors and patient advocates, because we know how we can connect these innovations and bring them to the people. But going into 2030, in the near future, we are going to probably see a vaccine. We are going to see treatment. It's called pan-TB treatment, universal treatment for both HIV, for both TB and MDR, just same tablets. To get to the people, it's going to require us. So innovation alone is not enough without community engagement. Innovation, the communities need to mobilize people. They are doing that to get screened, to fight stigma, as Luchika said, and even as Peter added, and to ensure the tools reach those who are. The Global Fund model recognizes this. And there's, of course, funding that goes to communities and CSOs in that model. And, of course, representation in the CCM and all that, and the important governance opportunities at the country level. But just as I move to closing is, what are we able to do? And an important area that I would like to talk about, Luchika talked about sustainability. International funding is coming down. I saw 3 weeks ago, there was a media clip about advocates at, I think, the Ministry of Health pushing for the new social health insurance for Kenya to ensure that HIV care and treatment is included in it. And so that's the language now moving about sustainability. How do we use other domestic contribution and innovative, and what is our role as the civil society in ensuring that these funding opportunities that are available? I know there's also some work going on in Ghana at an early stage in ensuring that the social health insurance does include TB and HIV. Going to accelerate innovation is going to be extremely important in the time remaining, but also integrating. I see even the language, and Luchika has talked about the bilateral agreement that the US is going to sign with countries. I think let's look at what are the opportunities in this new dispensation. And one of the opportunities that there is a move towards a lot of emphasis on integration, primary healthcare. How do we, as colleagues who really know, if you go to say in parts of Nairobi, Steve Shikoli will tell you intricately how the primary healthcare works, and it can integrate TB. How do we ensure that that shared information is brought? In closing, colleagues, the fight, we have the science, we have the tools, we have the evidence, but we need now to sustain unity and determination from government, partners, community alike. And the Global Fund remains firmly committed to standing with you, to invest for impact, to champion innovation, and to ensure no one is left behind. Thank you very much.
Thank you, Doc. Really appreciate the first session. And it is true, we really still need to talk about financing, funding. But what is coming out is that is still going to be an issue. And we need to look at domestic resource mobilization. We need to think internally. Sustainability has also come in. What I like is the fact that even lived experience. My apologies. Also, lived experiences is something that is crucial, and we've seen that from Peter's desk. Ladies and gentlemen, that was the first session. Thank you, Stop TV Partnerships. Thank you, the Global Fund, and thank you, Peter, for this. We're going to directly move to the second session, and it's being moderated by Dr. Lydia. Dr. Lydia, I'm going to hand over the baton because I think I even ate into your session's time. Sorry about that. But thank you very much, Dr. Lydia. Over to you. Hi, Doc.
Hi, Lizzie. Can you hear me?
Loud and clear, and we can see you. Over to you.
Great. Thank you very much. Good afternoon, everyone. And good morning, good whatever it is, good day to all our participants. First, I would really like to thank you, Lizzie and Inaso, for this opportunity to moderate this session. I also want to thank our keynote speakers, Dr. Enos and Dr. Luchika. You have really highlighted some very important points that cause us to be gathered here this afternoon. Now, going on very quickly to my opening remarks, I think that we are very cognizant of the fact now from the report and also from our discussions that medical innovations or science is really taking center stage and advancing in the fight against TB, and that there are regional commitments towards elimination of TB. But this is not going to be enough standing on its own without the engagement and continuity or sustainability of the work of our friends in the community and the civil society. This session, Funding and Resource Gaps, TB and Community, TB Community and Civil Society Perspectives, brings those realities to the forefront. We are going to hear from the voices of people that live these experiences daily. We will hear from TB-affected communities, civil society advocates, as well as a youth champion on how these financial barriers affect the work they do and how funding response, how funding truly is responsive to the people. We have heard from our keynote speakers that we have made significant gains in the year in the last year, 2024. For example, we had more people getting access to treatment. We had innovations in improving diagnostic capacity and new treatment innovations. However, these have been strengthened or pushed up by the partnership and support from our friends, the civil society organization, community champions, and peers. But we are also hearing that if we are not careful, we risk losing these gains. We are also hearing that we need to harness these turbulent times and think strategically and think of solutions. So the Challenge Facility for Civil Society Organization, CFS, has been one of the few flexible funding mechanisms empowering communities to act. Yet with shrinking donor resources and persistent underinvestment at national level, many community groups are struggling to sustain their impact. So today's conversation will focus on three key themes: sustaining the response, and our colleague Maureen Murenga will take a discussion on that. Bridging the last mile, which Dr. Enos also highlighted, will be discussed by Maxine Lunga, and then accountability and inclusion by our youth champion, Tanaka Makwa. So just a brief about our team. Myself, I'm Dr. Lydia Buzarira. I work with the AIDS Healthcare Foundation as the Senior Director for Quality Management and Medical Logistics. I will be joined by Maxine. I hope, Maxine, you are on screen, who is a TB survivor and passionate activist in the fight against TB. He's a National Secretary for the CAD and an organization for former TB patients. And he's also a TB community rights and gender expert. He has experience in community TB advocacy at national, regional, and global levels. Maxine? And then our other discussant will be Maureen Murenga, who is also a passionate advocate for health, development, and human rights for women and girls. She has a background in program management and community development and is a pioneer in the movement for young women and adolescent girls living with HIV in Kenya and a fierce advocate for ending pediatric HIV. Maureen is currently the Executive Director for the Lean On Me Foundation and is a coordinator for TB Women Global. Thank you. Maureen, you're most welcome. Then we have Tanaka, who received an honorary doctorate in 2021 from Zimunya High School for his advocacy to end child marriage and abuse. And he's also the Executive Director for Young People's Empowerment Network and Community Adolescents Treatment. Tanaka works with adolescents living with HIV and disabilities, helping them to access care, education, and social services while fighting stigma and discrimination. Thank you. So those are our panelists. And I would like to go straight away to the first question in the interest of time. So this first question is going to be addressed by Maureen. And Maureen, we would like to hear your perspective with persistent funding gaps threatening TB programs globally. How can communities and civil society organizations advocate more effectively for sustained and equitable domestic and international financing, especially with the Global Fund Grant Cycle 8 and national health budgets? Maureen, over to you.
Thank you very much, Lydia. I hope people can hear me. So, Lydia, in 1999, I lost my dad because he had TB and there was a national drug stockouts, so he could not be treated. And we watched him painfully get sick and die in the house. And then a year later, I had TB. And there was medicine for me, but stigma almost killed me. And then I thought we had ended the fight in TB, but about 4 years ago, TB almost killed my eldest son because of misdiagnosis. It was extrapulmonary. And just 2 weeks ago, we lost one of our girls where I work. She had drug-resistant TB, and it took long to start her on treatment, and she She died out of malnutrition and dehydration. So I think these are the things that should make us angry as civil society, because it can't be death on end. You know, we have to put a stop. There has to reach a point where we say enough is enough. And I think the anger should be not because we don't have enough resources in the world to end TB, but because we don't have political goodwill, we don't have enough support, and we also need to really, really strengthen our advocacy until we become very, very annoying, because without that, then we will keep telling stories that are very painful. I think we have a unique power as civil society to change this narrative of sad stories around TB. We need to organize, we need to document, and we need to demand accountability from our leaders and from those who are bent to or are claiming to be working in the TB response. You can see examples of countries that have strong civil society. Countries that have strong civil society have managed to get some funding for domestic resources. So it means that we need resources in the hands of civil society to hold our governments accountable to ensure TB is fully funded. And there's no better place to have these resources than in Challenge facility for civil society. One good thing about, and TB Women is a beneficiary of Challenge facility for civil society. These are the kind of grants that come with a component of strengthening the capacity of civil society. It comes with co-funding, and it comes with also some kind of partnership and organizing. And these are the things we need to improve our advocacy. So we all know that Global Fund GC8 is coming. For those who have been engaged in the replenishment conversation, it doesn't look very good, but that doesn't mean that we give in to not looking very good. Your countries will be developing their application to the Grant Cycle 8 Global Fund application. First of all, we need to ensure that all these CCMs have a strong representative from the TB community. The reason being that sometimes the TB community are piled up with other diseases and then it is drowned down. Or we have someone who is not very strong who can really put up a case. So we really need to ensure that our representatives at the CCM are very, very strong. The second one, we need to have data. Bring the real-time data from survivors about gaps in care, about the out-of-pocket costs, about how far people have to travel, data for misdiagnosis, and why people drop out of treatment. This is very critical in the writing process so that we are able to give a real picture of what is happening. Some people in that table have never gone to the community. We have information that they don't have. We have experiences that they don't have. Sorry, there's some background noise. Someone is moving out with a cat. So when funding requests are being drafted, make sure you are at the table. You don't have to have a master's degree to be in that table. You need to leverage your lived experience. You need to bring the data from the community and pitch it in that table. And then we know we will not get so much from the country allocations, seeing how the replenishment is going, but we need to push that through such strategic initiatives. Challenge facility should be getting resources for that because it has a proven track record of funding civil society work that goes beyond service delivery, but also ensures that we are reaching people who are hard to reach. So Stop TB, TB People has a campaign, and I hope all of us have joined the campaign. We need the strengthened voices. The community's delegation is also working with TB People to write a paper on why strategic initiative, why challenge facility should be prioritized in the strategic initiative. So please join in these advocacy moments and make sure that we are pushing for resources.
Hello, can you hear me?
I can hear you. I thought it's my end. I think it's Maureen. Maybe we can move on.
Okay, thank you very much. Maureen has highlighted the importance of data as we plan for the next stages. She has also called the civil society to participate, especially as we plan for the grant aid. But also she has talked about the important and unique powers of the civil society, which are to be organic, to document, and to demand accountability. So going on to our next panelist, Maxine. Maxine, I hope you can cover your ground in 5 minutes. Maxine is going to talk about bridging the last mile. And affected communities and civil society actors are often the first to identify gaps in TB service delivery. What practical mechanisms or partnership models can ensure that resources reach the grassroots level and groups where the burden is highest and impact can be greatest? Focus on youth, groups and clubs. Experience of service delivery models with potential sustainability aspects. Maxine, over to you.
Thank you, Dr. Lydia. Hello, everyone. First of all, I want to thank Ian Masso for giving us this opportunity to share our experience as TB affected actor in the TB response, and also as a affected TB community delegation board member. I want to thank also our lovely Dr. Luchika for her excellent intervention. Affected community and civil society actors, including TB survivors and key and vulnerable populations, are often the first to identify gaps in TB service delivery in all its aspects: prevention,
Hello,
screening. Hello, you didn't hear me?
No, we can hear you, Maxine. We can hear you.
Okay.
Carry on.
Maxine, you can
And Dr.
proceed.
Lydia? You can hear me?
Please proceed. Yes, we can hear you loud and clear. Please proceed.
Okay, thank you. Yes, I said that affected community and civil society actors, including TB survivors and key and vulnerable populations, are often the first to identify gaps in TB service delivery in all its aspects: prevention, screening, diagnosis, treatment, and support. Because we operate at the grassroots level on front line and are in constant contact with TB patients. Given that TB is not only a medical issue, but a public health issue, we know the specific needs of TB patients. In a recent year, TB communities have reached unprecedented height and achieved unmatched impact. The Stop TB Partnership Challenge Facility for Civil Society, the only global blended financing support mechanism dedicated to TB communities, has played a central role in this shift by strengthening community capacity, coordination, and influence in national TB response, ultimately saving lives. This funding is focused on the rights and priorities of TB-affected communities. However, shifts in United States funding priorities now place at risk the future impact of TB affected community and civil society activities, along with the intervention they lead and the system they have built, particularly in IKTB and DRTB burden countries. Current context created by the cessation of US funding and the access defined in the new vision of the American administration, which is summarized on essential programs, automatically exclude the community at the center of the action in the fight against TB. So this marginalization doesn't allow community actors and civil society to benefit directly from the funding for the activities that enable us to effectively contribute to the reducing, if not eliminating, barrier to access to healthcare, particularly to TB care. That is a big issue. While we know that because of all evidences that the community right and gender assessments have produced for us, without community activities in service delivery, legal support, adherence support, social and psychological support, fight against stigma and other barriers to access to TB care, partnership at all levels in countries with accountability, and advocacy for domestic resource mobilization. The elimination or eradication of TB remains only hypothetical. But now, with shifting donor priorities, this mechanism, challenge facility for civil society, is under serious threat. We are experiencing the cessation of community activities related to gender and human rights, community-led monitoring, social, nutritional, and legal support for TB patients, partnerships, and advocacy, and the reduction in the number of community actors engaged in the fight against TB, because many of the TB networks and organizations no longer have funding. With a full funded challenge facility for civil society, we can ensure increased awareness, partnership, and demand for access to new TB tools, notably grace to the innovation of TB Reach and the process of the Global Fund. We can also leverage emerging evidence to ensure the development of intervention to reduce and eliminate TB stigma in health settings. We can also ensure that every person with TB can access timely peer support and information. We can also promote sustainable social contract among challenge facility grantees to maximize its impact and sustainability. TB response must continue to promote the principle of a people-centered, stigma-free TB response based on equity, participation, and human rights. With Global Fund replenishment and grant cycle aid approaching, TB People, the network of people affected by TB, together with TB-affected communities and civil society partners from both implementing and donor countries, are united behind a clear priority: securing full funding for the challenge facility for civil society so that TB communities are not left behind. This is what TB People launched the campaign to protect what we have built and to secure our future. We cannot afford silence. The voice of TB community must continue to grow, not disappear. The single and clear goal of this campaign is a fully funded challenge facility for society for next grant cycle, GC8. To achieve this, we are calling on key donor countries: Australia, Canada, France, Germany, Spain, and the UK to either directly contribute 20 million USD per year, totaling 60 million over 3 years, or maintain a set aside from the Global Fund pledge to specifically support challenge facility for civil society and TB affected community. This is not about charity, it's about investing in dignity, rights, and impact. We have developed a set of engaging, flexible tools to support this campaign: powerful visual and messaging, Be Brave, Stand with TB Community, online petition. We aim to collect 10,000 signatures. We have already reached over 4,600. Coordination with embassies and national capital, social media toolkit, and digital banners. We can reach out to us and we can share with you the link. As advocacy, hospitality exhibition at the Union Conference, upcoming Union Conference, and also community corner to raise awareness, show solidarity, and raise funds for children in poverty. Without funding challenge facility for civil society, critical community-led work to advance human rights, break down barriers to care, and save lives will be severely compromised. The hard-won gains of the past decade in community system strengthening, equitable access, and the right-based TB response that save lives and enhance health security risk being reversed, jeopardizing global progress toward ending TB. And we need to move. Thank you for your attention. Over to you, Dr. Lydia.
Thank you, Maxime. Thank you very much. I don't know whether Dr. Lydia, you're frozen, but I really do appreciate the speech from Maxine side.
Without their
And
lived experience.
over to you, Doc. I think you're frozen for a minute.
Okay, thank you. Yes, Maxine, thank you. And we understand that the last mile is really going to be very capable and capably enabled by the civil society, especially people with lived experiences. We need them to bring timely peer support, to bring people closer to the innovations in technology that we have. So for our last speaker, we have one question for him. This person is representing the young people and the youth. And so, Tanaka, your question is, funding decisions often overlook the lived realities of people affected by TB. How can civil society and key vulnerable populations be more meaningfully involved in budget planning, resource tracking, and accountability mechanisms to ensure that no community is left behind? Tanaka, welcome.
Okay, thank you so much, Dr. Lydia. I think the involvement of civil society and key vulnerable populations, particularly young individuals, in budget planning, also restricting accountability for TB, is actually very crucial for ensuring that our specific needs and the realities are adequately addressed. So we must make sure that we foster meaningful engagement. It is essential to develop frameworks that prioritize the voices of those directly affected by TB. So firstly, fostering strong partnership between civil society organizations and government bodies, as Dr. Luchika was saying earlier, that we need government bodies. They can also create a foundation for effective advocacy. And CSOs can serve as liaisons, ensuring that community perspectives are represented in decision-making processes. And then this collaborative approach can be further enhanced by utilizing evidence-based advocacy, and then incorporating data from various sources and research sectors to advocate for policies that directly respond to the challenges faced by those affected by TB, especially young people. And then we also it is also imperative to establish systems for ongoing engagement and feedback from affected communities, whereby if those CSOs come to the communities and get feedback or data, they went to submit, and then they come back with the data to give to the communities, to feedback to the communities. And I think also mechanisms such as community accountability models should be implemented, where community members actively participate in monitoring and evaluating TB programs. Such approaches, Lydia, not only empower local populations, but also enhance the responsive of these systems to emerging needs and challenges of the communities and the young people. For instance, let's say direct involvement of young individuals in social accountability initiatives can improve transparency and ensure that funding is allocated effectively, directly addressing the identified gaps. So it is vital for civil society to leverage technology in enhancing participation. The use of digital platforms can facilitate broader engagement, allowing for real-time feedback, particularly budgeting processes where young people and key and vulnerable populations can express their preferences and needs regarding TB services. And also that furthermore, involvement of young advocates in training and capacity building initiatives can equip us with necessary skills to hold decision makers accountable and to manage resources effectively. And then we also, civil society should articulate their claims clearly to global health governance institutions, advocating for reforms in funding mechanisms to prioritize the inclusion of marginalized voices. This indicates a shift towards a more equitable health financing structure that recognizes and addresses like the disparities by different community segments, particularly vulnerable groups like young people. Yes. So comprehensive strategies that involve participatory budgeting, transparent resource tracking, and robust policy advocacy can ultimately ensure that no community is left behind in the fight against it. As I finish, meaningful involvement of young people and civil society representative in BIFA decisions is essential to achieve equitable health outcomes. Normally, I like the statement on Dr. Luchika's email that says, "The day we give up is the day we die." Thank you.
Thank you very much, Tanaka. I'm very glad that you have brought to the discussion table the issue of using digital platforms. I think we have missed this discussion, and most of our communities affected or concerned, or the policyholders are on these platforms. I'm very glad that you brought it out. There is also another very important issue that has been raised in the discussion today, the issue of integration by Dr. Enos and Dr. Luchika. We haven't touched it, but I think these remain core concerns for us to ponder, for us to meditate on as we plan and think through the next global funding cycle. My session ends here. Thank you so much for the panelists. And thank you so much, Lizzie, for your excellent work coordinating us. I hand over to the next group. Thank you.
Great. Thank you very much, Dr. Lydia. Ladies and gentlemen, Dr. Lydia is a passionate public health practitioner and health quality management specialist. AHF has always been supportive of health across the African continent. We always appreciate the collaboration. So thank you very much, Dr. Lydia. Moving on to the next session. Ladies and gentlemen, if you've noticed, we kicked off on a high note. We'll let the youth speak. And now we're letting the youth moderate. This is where my work becomes, it's all done. Aman, over to you. Now, ladies and gentlemen, Aman is going to moderate the next session where we're talking about innovation. And Sri Aman Shukla is the founder and chair of Unite Global. This is a youth-led movement advancing leadership and action and tuberculosis and promotes health equity, of course. So based in Delhi, India, Aman also serves as the board member of Key and Vulnerable Population Delegation to the Stop TB Partnership in Geneva. So he has a big CV. I couldn't read all of it, but quite impressive. Aman, next session is over to you. Appreciate it.
Thank you so much, Liz. When you started, you said that young people should be leading, and now it's moderating. Yes, I believe that we can do much more than this, than moderating, and this is a pathway to do more things. Thank you so much for this opportunity, and it's truly an honor to welcome you all to this important discussion on looking ahead, innovation, and mechanism to shape the response on TB. As we stand at a critical juncture in the global TB response, we are reminded that while progress has been made, achieving our shared goal of ending TB by 2030 requires renewed vision, innovation, and collaboration. Today's conversation will bring together powerful voices and perspective from financing to digital health and from governance to community leadership to explore how we can reimagine and strengthen our TB response for the next decade. I invite all of us to listen deeply, reflect critically, and think collectively about how we can move from innovation to sustained impact. Let's begin with our first speaker, Evelyn. Evelyn is a global health advocate with over a decade of experience in TB advocacy. Since 2015, she has served as Chief National Coordinator of the Stop TB Partnership Kenya and as the African Director of the African Parliamentarian TB Caucus. She is also a member of WHO Civil Society Task Force on TB and the Access to COVID-19 Tool Accelerator. Previously, she worked with the International AIDS Vaccine Initiative on HIV vaccine preparedness. Evelyn holds a BA and postgraduate diploma in mass communication from the University of Nairobi and is completing her master's in public health at Moi University. She's also chair of WACI Health and serves as a vice chair of AIDS Healthcare Foundation, advancing health equity and advocacy across Africa. So, Evelyn, your question is, what innovation financing mechanism, such as blended finance, social impact investment, or integration with universal health coverage framework can ensure sustained funding for TB program beyond the Global Fund's current cycle?
Thank you so much, Aman. Yeah, thank you for that introduction. Yeah, I must start by saying that I've been in TB advocacy for the past 18 years. That's close to 2 decades. And I've never been anxious in any moment of my life in TB advocacy like I am now, seeing that when we are on the final leg towards ending TB, or at least towards achieving the sustainable development targets of ending TB by 2030, when we're supposed to be increasing our resources so that we achieve that target, it's unfortunate that we are moving in the reverse. We are reducing the funds. How unfortunate. Now, let me talk about the innovative financing, like you have mentioned about the social impact bond, the social development bond, the universal health coverage as some innovations in health financing, which are very good initiatives. But if I dissect them a little bit, these innovations still focus on the curative side of TB response. If you look at them, they emphasize on the reimbursement upon delivery of impact, right? That impact is mostly quantified in terms of the number of people treated, the number of people who have been diagnosed. Still, it's more biased towards curative. And I also want to go back to the traditional fund financing mechanism that we have had. For example, the funds from the US, the funds from Global Fund. But when this shrank, the two mechanisms still chose to support the life-saving interventions. Again, let me not use the word ignoring, but going less on prevention. Tuberculosis is about prevention more than curative. And so any innovation that does not emphasize on prevention, I doubt if it's going to drive us or to take us to the targets that we want to go of ending TB by 2030. I am also very afraid that if you look at the country financing, again, it is all going towards curative. We can fund the most state-of-the-art building blocks as defined by WHO. We can have the state-of-the-art diagnostics. We can have the best diagnostics, the best treatment. We can have the most human resource or the best infrastructure. But if you're not investing in prevention, then I don't think we're doing the right thing. And how does prevention come about? I always say that a TB patient is 30% in the healthcare facility and 70% of the time within the community. Before they are diagnosed, they are in the community. After diagnosis, they go back to the community. Treatment takes place in the community. And that's why emphasis must be in prevention. And that's why I will echo what a majority of the earlier speakers have talked about, what has worked before in funding mechanisms that have supported communities. I'll take, for example, the Challenge Facility for Civil Society. I know Maxine has made reference to it. Maureen Morenga has talked about it. is one funding mechanism that has really supported those non-curative interventions. Creating awareness, it's one of the interventions for prevention. Addressing stigma, coming with innovations for community engagement, like the One Impact. I know somebody is going to talk more about that. Holding leaders accountable to commitments that they have made. Doing advocacy for resource mobilization from the domestic resources and others. We need very strong investment in that. So I will end by saying it's good that we turn to non-traditional funding mechanisms, but in it, we must emphasize on supporting communities. We must emphasize on funding prevention. We must emphasize on supporting advocacy, supporting accountability, supporting partnership creation. It has been shown to work. And I'm saying this coming from a country that has been on the right trajectory. We met the 2020 and 2022 targets for Sustainable Development Goals. We need to keep that trajectory, and we need funding going in the right interventions. Thank you so much, Aman.
Thank you so much, Evelyn, to kind of highlighting the importance of the prevention, because most of the time that we see people, when it comes to innovation, when it comes to the technology, people tend to diagnose and then they go to the treatment. But the prevention part is always ignored or overlooked. So I think CFCS helps in mobilizing community, doing the advocacy, partnership, and collaboration is the best mechanism for the community to do the innovation as well, right? So I think CFC's fully funding is also an essential part of the community in TB communities. And with this, I just want to move ahead with our second discussant, who will be talking about the technology and the innovation. Her name is Ms. Rabia Kaji. She's a public health practitioner and a community TB expert with over more than 10 years of experience working in community development project. She's currently works as the head of MEL, Monitoring Evaluation Learning, and the TB portfolio of SHDEPHA Plus in Tanzania. Rabia, are you here? Yes. So my question for you is, the next phase of TB response calls for stronger health and community system intervention. How can country leverage digital health tool, real-time data system, and community-led monitoring? For example, how Evelyn gave an example of One Impact, to make TB response more adaptive, inclusive, and result-driven.
Well, thank you so much, Aman, for this welcoming note. Dear colleagues, friends, and partners across the region and the global, it's a pleasure to joining you today, and I greet you all. So reflecting on the 2025 Global Fund Results Report, it paints out a picture of both hope and warning. While it celebrates its progress on treatment coverage by reaching the 75% globally, but still 7.4 million of people accessing care in 2023, it also alerts us as a caution that this progress is fragile. So we all know that the report highlights that nearly 73% of all international TB funding, any contraction in TB funding could undo the gains that the communities have fought so far so hard and very hard in achieving those results. So this moment now calls for something that is very deeper than innovation itself. It calls for integration between tools, between data systems, between community structures to make TB programs smarter, but faster and more inclusive, so that we can finally reach the missing people with tuberculosis. I'll talk of a case of Tanzania because where most of the work I've been doing in TB, we have witnessed a digital transformation supported through the Global Fund investment, but also through partnership with organizations such as the Stop TB Partnership, who collaborates, who funds, who supports the civil society work, like what we have been supported, FA Plus, but also Mkuta, TTCN, Pamoja TB groups, and many other global civil society organizations in reshaping the TB response from education to post-treatment of care. Looking at the education, at the awareness, platforms like mHealth, mHealth have helped, to do the self-screening for tuberculosis, but also looking at the One Impact, TB Kiganjano, One Impact application have given the communities the real-time access to information and to report the challenges across the country, of which these challenges have been resolved to ensure that the services provided for TB is of good quality. Looking also at the screening and diagnosis, we have this AI, the artificial intelligence through the card for TB, that enables the chest X-ray interpretation within a second. It has helped us to find more people with TB, especially these are coming from the key and vulnerable population, could be the minors, the children, the elderly people, among many others. So also looking at new diagnostic tools like TrueNut and the Gene Expert Alert, have accelerated the detection, but also linkage to care. Due to that turnaround time, from screening, then identify presumptive, then do the diagnosis, that has been really very useful. And besides that, because it goes beyond up to treatment and adherence, we see models like 99 dots that was supported, I think, by the Stop TB Partnership through the KNTV under the TB Reach initiative. It also helped. And video supported treatment mode have ensured that these patients are supported throughout their treatment journey and even remotely. So those are some of the data. But looking at the data system and the integration, at the national level, tools such as the DHS2 electronic tuberculosis reporting system, but also community tuberculosis app provide that real-time case tracking, not rather than before, because the paper-based was much, but now we have this digital reporting system. And alongside with that, for private providers, we see GIS mapping is also helping out, because it helps in linking the private providers into the national surveillance system. And it's one of the most significant steps when it comes to integrating the public, but also the private sector data. And going now to the community, we have this accountability tool. And this accountability tool, it's the One Impact, which is supported by the Stop TB Partnership through the CFCS grant, Challenge Facility for Civil Society grant. So Tanzania is one among of the beneficiaries, and it has demonstrated, a world-class model for community-led monitoring. And it has proven that communities, when they're empowered with digital tools and build the system that listen, you don't just get data, but you get the truth from what is happening to the community, what is happening to the ground. And the truth is the most powerful force we have to build a more adaptive, inclusive, but also effective for TB response for all. So through One Impact, we have seen that it does not only report a problem, but it's holding the system accountable. And its disaggregation of data has informed the National TB Program for improved TB service delivery from the KVP and the other most affected populations. And to me, I see One Impact tool as for its accountability. It's a game changer. It's a game changer in what sense? It's bringing communities and the government closure, because government can get to know the people, because we all know that most of the barriers, many barriers are coming from, or they originate from the people who have that lived experiences. And the solution are also known by the people themselves. So we see that there is that need, that crucial need for the civil society work to be supported so that they can raise those voices, they can reach the communities, and that's what One Impact achieves. So together, these digital tools represent the continuum of TB services from education, but to post-treatment, because it connects people, but also data and the system in real time. So yet all these achievements, our progress remains constrained by this funding gap now. Many of the issues now are happening. We all know that the technologies are existing, but sustainability of these innovations depends now on this predictable and flexible financing, like what other panelists have already discussed about this. So we see that being into this world of AI, we see that we need to keep using it because it goes far beyond the screening. It can help to predict treatment adherence, analyze some of the barriers, like what Maxine mentioned, barriers like social determinants, of that hinders people to access the TB services. And it also helps you to identify patterns of treatment among people who are lost to follow-up, but also they are predictable that they can help this NTP program to allocate more resources efficiently, but also effectively, especially when during this time where funding is also shrinking. So looking at countries like Kenya, Tanzania, and many other countries, we see that we have this foundation of digital systems in place, but we need now to connect this digital into one learning health ecosystem. So now we have this, we call it UCH, Unified Community System. It's also something which is coming. And this is where we see now the community's intelligence, where health data, but also innovation can work seamlessly, together. So before I jump into my last comment into that, I would say that there is a need now that Molin talked of the upcoming new global fund cycle 8. So we need to protect the community-led and digital innovation by ensuring that tools like the One Impact and digital adherence platform must remain funded as a core TB intervention, not as a temporary pilot. And we need to integrate TB digital system into national health framework, like linking them into the CLM data within the DHS2 systems that are used to for the NTP dashboard, but also looking at the universal health coverage financing system. That's also something which we need to see, because through doing so, we can ensure sustainability beyond the donor cycle. But we need to invest in people. It's not just the platform, having One Impact. It's not all about the platform, but it's people. Investment to people is needed. Equipping the community health workers who works with the people, who works with the affected population is really very important. So that one need to be supported. And we all know, yeah. So as I finalize now, so to mandate the CLM data into funding proposal, so we call for the Global Fund, to demand that country proposals are required to integrate and respond to a real-time data from community-led monitoring program. This ensures that funding is directed from evidence, by evidence, but from what? From the ground. But also for the civil society, challenge for the civil society, we all know that it has been a bedrock, of this great work for funding this accountability. So they must be protected and expanded and no cut. We all know that now funding has been cut and some small work is still progressing, but we hope that this work will be expanded, will be protected with no cut. And our
Thank you so much, Rabia. Thank you so much, Rabia, for sharing the insights on the digital health and community. We all understand in today's age, AI, digital health is very much important, and to integrate into the TB response is equally important to kind of achieving our goal. With this, I just want to go to our another speaker, who is a community expert and an expert on TB community engagement. James Malan is a human rights lawyer and a global health advocate working with the UN-hosted Stop TB Partnership in Geneva. where he leads effort on human rights and community engagement with the Country and Community Support for Impact team. His work focuses on supporting key and vulnerable population affected by TB through right-based and gender-responsive approaches. With a master's degree in law, governance, and international development, James brings experience from the public, private, and non-profit sectors, having previously worked with the civil society organizations in the Asia-Pacific region. His expertise spans community engagement, policy development, and program management, and he remains deeply committed to advancing social justice and equity in global health. James, like you, your bio is amazing and interesting. And the question that I have is, we have a very good global fund processes and the mechanism, and we are aware of it, like CCM, PRs, and the voices of TB affected communities and the civil society. How can we strengthen their collaboration towards eliminating TB by 2030?
Thanks so much, Aman, for the very generous introduction. And, I note that I think we're a little bit behind time, so I'll try to just provide a concise answer here. So, look, a lot of people have spoken in depth about the different mechanisms at country level, important structures like the country coordination mechanism, the CCM. But also, I guess there's the importance that in terms of global fund, you also have principal recipients, sub-recipients, and sub-recipients as well. Now, a couple of things that I think are really important to take stock of here is that Stop TB with partners has done an assessment of CCMs. And what we know is, objectively, TB is underrepresented. Now, if it's underrepresented, it's very difficult for TB to effectively influence the agenda and for priorities of the TB community to hold the same weight. So this is something that's very important for us to be clear on and to reflect on, because there's a need for us to either begin to change the way in which representation sits on CCMs so that TB voices are there first and foremost, and secondly, to recognize the importance of building partnerships with others on the CCM so that those TB priorities don't slip. Now, just to give some examples, we know that in many countries in this region that this webinar is focusing on, TB HIV co-infection is a principal issue of concern. But what is also critical here is when people sit at a CCM and they bring issues from the HIV community and the TB community, what we generally see is some of these key things for TB slip down the agenda. For example, rapid molecular diagnostics, TB preventative therapy, short course regimens, having interventions for CLM that really build on TB structures, having interventions for stigma that are specific to the TB needs. Now, until we have those, it's very difficult to get the changes that we need to see in the TB response. The same can be said for many PRs and SRs under Global Fund grants. And so again, there is a critical need to engage these partners and to make sure that there's sensitivity around these TB specific needs. Now, a couple of things that can be done here. First and foremost, there's a need for TB communities at country level to have briefings with your CCM to really talk through those priorities. Second, there's a need for TB communities at large to be able to sit down, to meet, and to discuss priorities, get them down in writing, and to submit them to your CCM to ensure that those priorities feature when funding requests are drafted and developed. Now, heading into Grant Cycle 8, this is more important than ever because of the way in which funding requests will be developed and approved is going to be a much more direct process, and it will likely have lower levels of engagement than have been there previously. Now, the third thing I would say is that in order to be able to influence the CCM, to reshape the CCM, to make sure your priorities are heard by the CCM, and to do the same with PRs and SRs, there's a need for smaller community orgs, networks of people affected by TB, networks of young people affected by TB, networks of women affected by TB, TB key and vulnerable populations, to have a means to be directly funded. There's only one mechanism that does that, is Challenge Facility for Civil Society. So without us making sure that those groups at the grassroots level, those smaller organizations who can support and fund and engage and to be funded to do that, then it'll be very difficult to really impact under Grant Cycle 8. It'll be very difficult to reshape national strategic plans. It'll be very difficult for there to be sustainable TB responses at the country level. So I think that there's a critical need for all of us to really prioritize making sure that we are engaging with our CCMs, PRs, and SRs, but equally that we're advocating for funding directly to grassroots, TB-affected communities, TB civil society, TB key and vulnerable populations to be able to do this work in demand creation for new TB tools, in advocating for zero stigma for TB services, in making sure that there's adequate peer support led by TB-affected communities for people on TB treatment, and to make sure that these changes are sustainable. So with that, I might leave it there. I think that there has been progress, and Luchika touched on it in the beginning. And one of the areas of progress she mentioned was this movement of people affected by TB that we now have, that we did not ever have before. And so it's critically important that this success is not just protected, but it is scaled up, and Challenge Facility has a critical role for that. And the only way that that will be funded is if all of you lend your voices in support, really reach out to different partners to share the success stories that you have and the importance that this has for you. Thank you, Aman, and back to you.
Thank you so much, James, to kind of giving a clear guidance on how, like, GC8 is coming up, and we need to have this information ready with us, because engaging communities, civil societies, and networks at the CCM level is very much important, because most of the time, TB is always unheard and underfunded at the country level as well. So I think the points that you have made, I think in coming days, we can kind of make a one page of and share it with our communities also, to kind of engage with the CCM and make sure that our voices are heard at the CCM, and the global funds money comes to the community as well, which is required to end TB by 2030. Thank you so much, James, for that intervention. Moving forward, we have another speaker with us, Dr. Stephen John. Who has been active in TB, leprosy, and HIV control program in Nigeria since 2003. Having served as a TB program manager and an HIV agency executive secretary, Stephen is currently a health ministry director of planning, research, and statistics. Stephen has served as a trainer at the National TB and Leprosy Training Center, Zaria, Nigeria, a mentor to state TB and leprosy program manager, and a university teacher. Wow. And he has been a consultant for several organizations, and it's presently serving as a technical consultant to the United Nations Office for Project Service. His interest in TB control among key and vulnerable population and underserved population is in Northeast Nigeria has grown over the years. Welcome to this panel discussion, Dr. Stephen John. Your section is very much important for us to move forward, because your section is something which is part where it is secured from the donor's priority. My question to you is, what innovative tool, technologies, or community-led approaches shows the greatest promise to accelerate TB detection, treatment, adherence, and prevention in high-burden countries? Like we have a very good mechanism called as TB Reach by Stop TB Partnership. Yes, over to you.
Thank you very much, Aman. Always interesting to speak about such topics. I know this is not the first time we spoke about these issues, but today is another opportunity again. So as a person with a huge interest in KVPs and also, of course, communities, it is important to recognize that the magic bullet in all this lies around the community itself. The biggest tool is the community engagement. This has been interpreted by different people in different ways. In the past, traditionally, we were taught on the steps of community engagement, which you can see in most of the NTP guidelines, but this is not, it often comes short because of the lack of innovation within it. How effective are we engaging the communities? Are we leveraging on unknown channels, you know? And then what roles are we enabling the community to play while we try to see what impact is made? So leveraging the community strategically is very important. For instance, what we've done in Nigeria, in the Northeast, you know, is that we're dealing with vulnerable populations that are so conservative, where the normal community engagement that you see that is being written in the guideline wasn't working. So it was very important to sit down and ask the question, why? You know, what we discovered was that first, there are different layers of stakeholders within the communities. You don't identify this stakeholder for them. They know their own stakeholders. So you have to give them the room to make sure that these stakeholders are carefully identified. That's one. Number two is, you know, you cannot carry along all stakeholders. You hear people saying all stakeholders, but you can carry along key stakeholders. You have to sit down, make your analysis, because the larger the numbers, then the more problems you have. So we made sure that we trim down to the key stakeholders that have to do with the interventions, the ones that you can manage. You know, you have to manage every stakeholder, you know. Then number three is that there are certain innovations within community engagement. For instance, when you're dealing with like the nomadic communities that we did, you know, we discovered that we needed to have a focal point from the nomadic community itself to lead the intervention. We even gave that person a title, like a project officer, you know, like that. And he's so happy about that. And this is a man that, like, the dictionary of the locations, the cattle routes, the communities, the resting points, all those things, you know, they know these things. So when you push them in front and you follow them, then you're going to harness these particular potentials in community engagement. So this is very important. And I would like to say that in our current TB Reach grant that we are implementing, meanwhile, thanks to Stop TB Partnership, because some of those things that we bring in from CFCF are being implemented even as part of the TB Reach grant right now. So in this particular grant, where we do integrated service delivery approach, we see that it's easier for the community to come, you know, to mobilize the community and screen for everything at once. So through proper community engagement, you're able to extend your services beyond TB. We do malnutrition, we do pneumonia, we do leprosy. You understand? And if you remember very well, for those that were active 20 years ago, you can't just go into the community like that and say you want to screen leprosy and then you see you're mobilizing the community easily because of the stigma, because of how people view leprosy. But it's becoming very different when you go through integrated service delivery. So that is very important. Then another very important aspect, innovation that you need, you know, if you're dealing with community, is actually leveraging on the available resources. For example, how many of our community interventions leverage on the people themselves? If you're dealing with IDPs, okay, you're recruiting volunteers. What is the proportion of the volunteers that are IDP youths themselves? A lot of programs you see, they're bringing volunteers from outside, they're bringing staff from outside. Now, without leveraging on the existing resources within those communities, then you are already plotting to fail. So this is a very important innovation. Now, for us, practically, in all our interventions that we target KVPs, from nomads to IDPs to refugees to minors, over 80% of the people that we use, that we work with as volunteers, are from those communities. And who chose the volunteers? That's another innovation. Who chose the volunteers? It's not you as a program. You make sure that the community leaders that you mapped, those key stakeholders, you put it to them, you know, give them the criteria, and they will choose for you. They will pick, identify hardworking people that will show proper commitment, that will take you to the impact that you want to achieve. So this is very important, rather than you going to try to like boss and identify the volunteers yourself because you know a couple of people in the communities, you know, that doesn't work. So that is very important. And this leads you to a very important point. We're talking sustainability all the time. Now, local ownership. You breed local ownership when you have a proper engagement of the community leaders I'm talking about, and then leveraging on the existing resources. Because I can assure you, after the project cycle, if your engagement is right, you will see interventions continuing. That is very important. So then, of course, there's something magical again, you know, when that I've seen also that kind of galvanizes this potential from the communities, which is how you deploy. For instance, now in the past, we had like training modules. Like you want to train people in the community, you come and do for TB, then you come and do for another disease, or on occasions you might combine TB and leprosy. But for the first time, we have tested out an integrated training curriculum that combines all this at once. And then the community response was marvelous. You're bringing everything, the basics to them at once, just like a one-stop shop, like that. You're teaching them everything. And that's how also the screening goes. So this is also a very important innovation that I've seen that works at that particular level. Then, of course, let me borrow from our Wave 11 intervention as well again, that the screening that we do in the integrated service delivery now also includes other disciplines like a nutritionist. You have a nutritionist on board, then you have the healthcare workers, together they will screen for about 4 diseases at the same time: tuberculosis, malnutrition, pneumonia, and leprosy. So there is no favor, there's no service that you can give a community that will make them as happy as screening for those basic conditions that are so prevalent, especially in the areas where we are right now. So these are some of the innovations, And lastly, let me say, right now we are trying out this near point of care kits. In the northeast of Nigeria, we're taking it to the most remote communities, hard to reach communities, using tongue swabs, and sputum swabs. We're testing a lot of people. We've tested over 3,000 within the space of 2 months now, getting to the 3rd month, and the results are magical again. You heard Dr. Massini speak about this earlier. So these are some things that, the community likes seeing coming, the innovations, in terms of testing, in terms of all those things that Lushika mentioned, taking it right to the community. And then I would like to borrow from what Rabia said, that also I think Evelyn also said that it's not only the innovation, it's not only, what we're talking about on the top, it's delivering it out there. You need to invest in people. You need to make sure that people get this there. And we must not forget the people, the survivors, the TB survivors. So, of course, ISD, like integrated service delivery, works very well and gingers the community and brings them very close, to where we want them to be, and potentiates, of course, achieving our results. Then we know that community is central and must be involved. Without involving the community, there's a problem. Then the technology I'm talking about here catalyzes and enhances the projected impact that you already have. Then you must not forget coordination and leadership, because these are the elements that drive results. Thank you very much.
Thank you so much, Dr. Stephen. It feels like keep on listening to you, because there are so many innovation ideas that you have seen, you have worked, and you have implemented in Nigeria and other parts of the countries. And the way that you have put in the community into the innovation is interesting and is amazing to follow for all of us. And in your message, you were trying to say that when there is an innovation, there has to be community equally involved into that part. Otherwise, it is not going to be a sustainable kind of a approach to the community, because innovation can be made by 1 or 2 person, but that innovation you have made for the community should be reached by the community itself only, because we will be not able to leverage that innovation until unless we don't involve the community. Thank you so much for these interventions. And we had 200 people joining this call, and we are at 154 people who are still there in this call. I just want to request, and I've seen that all our panelists talked about CFCS, and there is a campaign going on by TB People Global along with all the country partners. So I just want to request all the partners who have joined in here can kind of sign in and support the CFCS fully funded. So I think I'm not able to, okay, see. So I've just shared the link in the chat box. Please, friends who have not signed in to support this petition, please sign in and support this cause, and urge world leaders to increase the funding for TB, against TB, especially for CFCS, which comes to the community. Thank you so much. And now I will hand it over to my colleague, Rachel from ACT Africa, for the question answer round.
Thank you so much, Aman. I hope I'm audible, and thank you to our panelists and our moderators. It's been a great discussion. There's so much we are learning from here. And I must apologize that we've exceeded our time. And if we could plead that you stay on for extra 10 minutes, we promise to do everything within this time to ensure that we close within that time. May I now call on all our panelists to put on their cameras? Kindly put on your cameras. And for those who are asking questions in the chat box, kindly note that your questions are being answered in the chat box. And so we are going to give time for those who have their hands raised. Just in case you have any questions, feel free to raise your hand. And I'll hand over to Karani Franklin first to ask your question. Over to you, Karani. And it'll be good if you contextualize your question to a specific person who should answer the question. So kindly be specific on who should answer your question and what your question is about. Kindly make it brief. Over to you, Franklin. Is Franklin on the call? Karani. It's time for questions. So if you have any question, feel free to raise your hand.
I think, Rachel, you can move to the next person in the interest of time.
Yeah, I don't see any hands raised. Anyone with question?
Maybe we take one. I saw one for Tanak in the Q&A section. And there's a hand now. Philip, yes, we can allow you to talk, so please proceed.
Yeah, Philip.
If you can.
Okay, thank you. Thank you very much, Lizzie. Thank you, panelists, for the good insight. This is Philip Nyakwana from Kenya. Philip is a represent TB-affected community at the CCM and also the chair of the non-state actors at the CCM. Mine is not really a question, but a comment. I think, and this is a call that should go to all of us, the advocates out there, because most of the time, when you see Global Fund issue directives and in terms of their funding and the direction they're taking, including when we're doing reprioritization, they talk about the life-saving interventions. And the assumption has been life-saving interventions are commodities. Most of the time, us as advocates, and even the people at those platforms, we go silent without unpacking what does life-saving really mean to us, and in the community context, how is it derailing the community efforts when we want to put all the life savings towards commodities and such kind of thing? Because I believe, as my colleagues Evelyn and the rest alluded to, we can only end TB by preventing TB. We cannot just end TB by treating people who are, and even treating those people, there are barriers to access to TB services that need to be addressed. And they can only be addressed at the community level. We can only achieve that if we prevent TB from occurring, unlike putting a lot of emphasis. Another issue is around TPT, and some people alluded to it. There's TPT, yes, but there are a lot of challenges with the uptake of TPT, including our approaches. So I think it is something that we need to take stock. What approaches in terms of TPT are working, and which ones are not working, and how do we maybe navigate so that we have something that is working. Most of the places the drugs are there, but the uptake is low because maybe the community involvement and also their participation in terms of initiating some of these processes. Another issue is around communication. How do we communicate around some of these innovations, or how do we communicate and create demand around TPT? And that demand also comes with support. I still feel that some of our strategies are not helping us, and we need to revisit and change them where need be. Thank you.
Thank you so much, Philip. That's great observation, and I know they are hearing us, and that's why it's good that we always have these sessions like this to see where we need to change and how we need to move forward. So that's a good observation and a great comment. Any other question? Lizzie and the panelists, it looks like everyone is good with the session. I think things were very clear to everyone, and I'll hand over to Stephen to handle the next session. Thank you, and over to you, Stephen.
Yeah, thank you very much, Rachel, and thank you very much, our panelists and all champions that have joined the call. We really appreciate all of you for taking your time and joining, and we condole with the families in Kenya for losing your former Prime Minister. We are together in prayers. So thank you very much. I think today we've had a very important conversation and very strong things were coming out. Just to pick a few highlights. Which is number one, I think it was coming in very strongly that we need strong representation of TB-affected communities in those key decision-making areas. For example, in CCM, in a global level, and we need communities that are affected to be there who represent the communities and are able to negotiate for the shared opportunity for the affected communities, because many a times that we've noticed that sometimes TB is squeezed in the room and we only have one representative, while other health issues are having multiple representation. That one was coming in very strongly. And then the component of sustaining whatever has been put in. For example, it was coming in very strongly from Dr. Luchika that some resources were put in for TB. And when the funding reprioritization came in, TB was tackled. We need now to have strong advocacy to ensure that we are sustaining those funds and those resources that are put in place, including measuring into innovation. It's up to the countries to take up the new innovation. It was very strongly highlighted by our colleagues like Evelyn Kibuchi that these innovations are made not for doctors, but for communities, and they need to be brought closer to the community because TB is not in hospitals, TB is in the community. So the component of reaching the unreached, it was very strongly discussed in the component of KVPs. And if we don't reach out to the vulnerable population, then we will never end TB. That was coming in very strongly. And a very key point was that the community is the bullet that we have to end TB. And we need to invest in community level interventions, the likes of CLM. We need to protect and guard it. Another that was coming in very strongly, and I think Maureen brought it very strongly, that as communities, we need now to position ourselves and tell our NTPs, our ministries of health, that we have data using in
Am I having internet issues?
Sorry. Yeah, I think there's an issue with his conclusion. Yes, powerful points, but what we know, ladies and gentlemen, is yes, we still do need to work on funding, we do need to work on advocacy, but we also appreciate the fact that we have partners as well, backing up communities and civil societies. Ladies and gentlemen, we're truly apologetic. We had to use 30 more minutes of your time, but the recording, there you are. Maybe you can conclude. Yes, over to you.
So I'm saying that we need to have a strong negotiation, and also we need to invest in community-led interventions by appreciating the data that communities have, using the innovative tools, the likes of One Impact, that have shown that communities have data that can be trusted, and this data can be used to tailor-make interventions in different communities. We should not leave that data lying aside. And then also in terms of bringing together other players that are also non-health sector players, it's in the component of multi-sectoral engagement by bringing the non-health players to come in and fund interventions in TB. This was coming in very strongly. We need to advocate and tailor-make our message, showing them that anytime a person misses their work because of TB, then the productivity goes down. We need now, as advocates, as champions, to come in with strong messages that will move those private sector to come in and invest in TB. Then finally, a very critical point that came in was we need to understand what we say by community, by appreciating the value of community when it comes to the fight against TB. so that communities are not just brought in a room of 100 and we say we engaged communities, but we need to appreciate the value that each community and especially the affected communities are bringing on the table when it comes to fighting TB in different countries. And funding, a very key point that came in is that we need to also think outside the normal funders that are Global Fund, USAID, and look into other people that are there that have resources, that they do CSRs, the corporate social responsibility. We need now to tell them they need to also fund a kitty like investing in addressing the TB matters. So those are some of the key highlights that I was able to pick. I know the recording is there and we have a lot of insight that we got from all of you. We really appreciate and we thank all of you for taking your time and coming in. Thanks to Global Fund for allowing us even to discuss the Global Fund report. They wouldn't have given us a chance to discuss the Global Fund report. Thanks to Stop TB Partnership Geneva, as well as Stop TB partnerships that are represented in different countries. We really appreciate the support that you have given our communities. We really want to thank Africa Coalition Against Tuberculosis, that is ACTE. Thank you very much, because by working together and collaborating with communities, we are hearing community voices coming in. We really want to appreciate Unite Youth, Global and other countries that are represented in Unite Youth. Thank you, because now the voice of young people are being heard, and we really appreciate. We want to appreciate the TTCN. This is the Tanzania TB Community Network. Thank you very much. We really appreciate for making this happen. We really want to appreciate Mukuta. It is great to have you on board and to have this conversation. This is great. Thank you for Yanaso. Always great to have you, because you open your doors to ensure that we are having several webinars in different platforms, X, Y, even in Zoom, Teams. We really appreciate. We want to appreciate the network of TB champions in Kenya. Kudos for accepting to join this call and to coming in, and all the panelists and all the champions that have left their work, have left their time to come and join this conversation. We really appreciate your presence. And if I forgot to mention you, we really just appreciate, just feel valued. Because of time, I was not able to call everybody. And also for the CCMs that were represented here, I saw Philip Nyakwana from KCM. I know Maxine Lunga sits in another CCM. We really want to appreciate and thank you all for giving us time to listen to us and even giving us a strong insight. We have been able to package some of the information that you have given us in the chat box, and we will summarize them and package it as part of the meeting report. We really appreciate and looking forward to our future engagement in other webinars. Should we have a future webinars, we need to have you, and tomorrow or the other day, you might be the one that will be a moderator or a session speaker. Once we call upon you, kindly avail yourself. We know communities are very strong. We look forward to engaging you. Thank you very much, and wishing you all the best. Back to you, Lizzie.
Thank you all. Have a great afternoon, a great morning. Really appreciate the time. Goodbye.
Thank you. Bye.
Bye-bye.